So the CDC guidelines and also the National Pain Strategy emphasized the role of behavioral factors, pain psychology in the experience and treatment of pain. And so most primary care physicians may not be aware of the critical role that psychology plays in the pain experience and in patients' treatment needs. So this is fundamentally the first piece that would be helpful for them to know about.
I liken pain management to a team sport. And we all need the right players on the team. And what we're all brought up in having is all of the same type of player. In other words, as a card-carrying physician, I'm surrounded by physicians and we all look at the patients through a certain lens. But in working at Stanford and also seeing other places, I appreciate the value that pain psychology brings, that physical therapy brings, that all of these different viewpoints on the patient bring to the care and assessment of a person with pain. And so I'm probably one of the biggest advocates you'll find with having a very well-rounded team, and pain psychology is just such a critical part of that. I was honored to co-chair this effort with Dr. Linda Porter from the National Institutes of Health. So the National Pain Strategy was an outgrowth of the Institute of Medicine report on pain. And I was honored to serve on that committee and co-author that report. And that report, the Institute of Medicine report on pain, was a 30,000-foot view of where the country is and where we need to go in the standpoint of pain. But what was missing in that report, and we knew this, was a strategic or tactical plan on how to get there. And so the National Pain Strategy was the follow-up to the IOM report that was to take all of that blueprint, if you will, and bring it into a tactical document that would have specific objectives that were time-based, that would identify who the stakeholders were, and would have accountability assigned to it. And that's what we put together with the National Pain Strategy that crossed all these dimensions of education, of service and reimbursement, of disparities, of data, of prevention and care. And I'm absolutely thrilled with the final product. The final product is, as people will read it, it's motherhood and apple pie. You'll read this and you'll say, well, of course, we have to do this. And that was the intent of the National Pain Strategy, was to pick things that we all know we need to do, to put it into language, but then to show how we can go about accomplishing it. And so I'm encouraging everybody out there, read the document, get behind it, call your representative in Congress, beat the drums, and let's get support for this.
The CDC guidelines in particular, which were issued earlier this year, really recommend the limiting of opioids for chronic pain, and even it's put forward the emphasizing of alternatives such as pain psychology treatments. Cognitive behavioral therapy as being really the primary gold standard approach at this time. Unfortunately, we don't have major national systems in place, the infrastructure in place to appropriately steer patients towards these psychological treatments. Some patients do have the luxury of accessing gold standard pain psychology treatment, but many do not. And so while the CDC guidelines have focused on limiting an aspect of pain care, at this point the government really needs to invest in the infrastructure, the proper education of clinicians, and ensuring that all patients do have the access to the treatments that they are underscoring as being effective and appropriate. And we have a ways to go right now.
It's going to take all of us working together. What I mean by that is we're all right now looking to the federal government to solve these problems for us. And we're going to need the federal government. We're going to need HHS to take a leadership role. And they are right now in the process of putting together an internal task force around this. At the same time, there's a great opportunity for all of us to identify areas within the National Pain Strategy that we can get behind. There's 17 of these strategic goals. And so if you are a person who is suffering from pain, reach out to the patient advocacy groups. They formed the Consumer Patient Advocacy Task Force and have come together to help promote the National Pain Strategy. If you're a physician watching this, reach out to, for instance, the American Academy of Pain Medicine. We have a task force that similarly is working to promote aspects of the National Pain Strategy. What I mean by aspects, we're behind all of it. We all see the benefits of it, but when you try to get behind 17 strategic goals, it gets overwhelming. And so I would say to people, don't try to figure out how to solve all of these. Find one or two or three that resonate with you, and then find ways of getting involved to help advance those successful creation of those goals.
So from a policy perspective, I mentioned that often there's a lack of access to pain psychology treatments. What's needed fundamentally is better education for mental health therapists, for psychologists, really and truly for all clinicians. We need better education in pain, but in particular to address this lack of access to pain psychology treatments, we need better education at the undergraduate level, at the graduate level of education, at the postdoctoral level, and also continuing education efforts. And so federal efforts that would facilitate better education are greatly needed. We also need to ensure that there's good insurance coverage, access to these treatments that work. And ultimately, we need platforms that will allow clinicians and also patients to identify skilled pain psychology practitioners. And right now, we don't have good systems for any of this. So there are multiple barriers that need to be dismantled. And I will also say that from a policy perspective, additional funding for pain research is needed so that we can continue to innovate and develop treatments that are focusing on rapid access to targeted treatments.